Joining me on this special Budget Day broadcast is one of India's topmost doctor, Dr. Samir Parikh. Dr. Parikh is also the chairperson of Fortis National Mental Health Program. Dr. Parikh, thank you for joining. Nirmala Sitharaman's budget specially mentions mental health. Why do you think it is crucial?
Oh, it's a milestone. It's a landmark moment in the history of Indian healthcare. 20 years back, would we have thought about the kind of importance given to mental health? Would we have even thought that the mention of mental health and the impetus on mental health would happen? For me, this is probably one of the best things to hear. The fact that infrastructural support is promised, the fact that we will have another NIMHANS approach, which basically means from infrastructure to intervention. And most importantly, this is going to translate into a future where mental health will be prioritized and healthcare providers, including private sector, will also have to support the initiatives by the government policies as they continue to prioritize mental health. And I think it's a very, very, very welcome step.
Dr. Parikh, what do you think are the two or probably three big takeaways when Nirmala Sitharaman, please elaborate about the push that she has brought in her budget speech.
So if we allocate funds, we recognize the importance. We talk about the youth, and one of the strongest pillars for youth success is going to be mental health.
Correct.
By allocating infrastructure, it's not merely an intervention. You are creating brick and mortar infrastructure, which will raise the bar of access to mental health. It is going to raise the bar of acceptance of mental health. And this will also then shape way to a long-term resilience of young people, overall well-being, quality of life. This is how you build a healthy India, by prioritizing mental health. And the fact is, mental health has been the neglected elephant in the room always.
True.
And for mental health to be focused upon, it recognizes that how we are finally at that juncture of our growth as a society, that we recognize that mental health needs to be prioritized. And it starts from the budget, let's say, because funding has to be there. It's a day I will remember, a day I wouldn't have thought happening. So from my end, big thank you to the Honorable Finance Minister, more importantly, to our Prime Minister, who continues to support mental health.
Lot of young professionals these days, even athletes, not just the working class, even athletes are complaining more about anxiety, depression and such things coming with as screen time grows. Like people are getting these symptoms are being reported more. You think like in terms of infrastructure and the acknowledgement of a problem there in terms of anxiety and mental health, this is one step ahead, like Sitharaman has thought that, okay, this is a situation that we need to preempt and maintain our infrastructure?
Yes, I had gone to the Paris Olympics as the mental health expert with the team, which also was the first of its kind. And I do feel that also showed how there is a continuous focus upon mental health, because athletes and mental health, not just about taking care of them, but it's also shaping their success, is how mental health is important. I think that also was a very important decision by IOA and the government agencies to ensure this happens. I think that's remarkable. And now we back it up as we move forward. We talk about workplaces, we talk about youth skill building, we talk about focus on youth, and we talk about another NIMHANS. The government is supporting Tele-MANAS, which is the digital mental health intervention. And like I said, when you see the highest decision-making bodies at the parliament, through the finance minister, through the vision of our prime minister, when you talk about mental health, this is how you break the stigma. This is how you tell the society that mental health is important. This is how the narrative is changed. This is how you shape the future for young people by prioritizing mental health.
I heard Sitharaman also mention about Tezpur and Ranchi and NIMHANS too. I would like you to probably elaborate our viewers on what exactly this NIMHANS will work on.
NIMHANS is our primary premier institute of mental health. It's at the forefront of mental health now since I mean, this is the best that is there. I think globally, NIMHANS would be at par or above any other mental health initiatives by across the world from public health's point of view. We've had one NIMHANS catering to a large society like ours, and now the fact that we'll have more NIMHANSes, I think that's very, very, very positive, and it will shape the future. I'm convinced that it is these kind of steps and initiatives will also get other healthcare providers, because I do feel that when public healthcare moves forward, private healthcare also needs to support.
Correct.
And collectively, we need to build the future for the youth of India. And the future of the youth of India will need strong base. And that base is going to have positive mental health. You cannot neglect mental health and build a future, neither in health nor otherwise.
Dr. Parikh, now talking about private sector, I have not gone into the fine prints of this budget, but do you think that this budget will pave way for more private sector people coming and investing in it, creating infrastructure for mental health? Is that also something that Nirmala Sitharaman has done today?
Two ways. I think there is a focus on medical tourism. I do feel that when we talk about medical hubs and medical tourism, you can't have medical tourism or medical hubs without a strong mental health initiative. It's most tertiary care will require mental health support. I also feel that when a step like this is taken, I feel others' eyes and minds will open up. For me, it is about breaking that ceiling and saying, okay, let's do something in mental health. And I sincerely hope that all healthcare providers are prominent people working in the private sector also support mental health, because mental health's time is now.
Thank you, Dr. Parikh.